So I'll be going out of town and you will be taking care of my patient Blaine McCartney. Mr. McCartney is a 61-year-old Caucasian male who was admitted into the emergency room this morning around 3 a.m. with his jaw stuck open. Says that his jaw is constantly clicking whenever he opens it, as well as complains of temporal and mandible inflammation. He has myositis in the cervical region of his spine, as well as dyskinesia when he turns his neck or head. He has chronic grinding of the teeth at night as well. Some past medical history that's important to know is that he was diagnosed with arthritis in 2016 and then rheumatoid arthritis in 2017, so they just specified it a little bit more. His physical examination overall was good, except for the muscles area. His joints and muscles are both very fatigued, as well as stiffness and swelling and tenderness in the joints, which pairs along with the rheumatoid arthritis. Some exams we ran were an x-ray of the jaw, and then we ran a computed tomography scan, which is a CT scan, to examine the bones and joint tissues. And then we ran a magnetic resonance image, an MRI, of the jaw to see if there was any structural problems. Our final diagnosis was that Mr. McCartney has temporomandibular joint disease. Before we figured that out, we went ahead and closed his jaw by giving him some Valium and then manual manipulation of the jaw back into place. Anesthesia was there if needed, but it was not needed. We discussed future procedure options with Mr. McCartney, both surgical and non-surgical. Some surgical ones were the TMJ arthroscopy as well as an arthrotomy. We also discussed some medications such as pain relievers like ibuprofen or muscle relaxers that are prescribed. Therapies were also discussed, such as a mouth guard for the grinding at night and physical therapy to strengthen the neck and head. At the end, the patient decided to not do surgery and avoid it for now, and he's going to do medications, physical therapy, and a mouth guard instead. We told Mr. McCartney to do soft food as much as possible, as well as avoid gum and sticky and chewy food. We taught him some stretches and exercises to strengthen the jaw muscles, as well as ways to massage his muscles on his own. We also showed him that there can be heat and cold treatments to do on the side of his face. Some relaxation techniques were offered, as well as the use of chiropractic care. And that's it.